Developing a formalized framework of spiritual nursing is significant in the Philippines, especially since holistic nursing believes in the relationships among body, mind, and spirit, thus the conceptualization of spiritual nursing care theory. The theory was developed following a deductive axiomatic approach. The researcher developed propositions on how two or more concepts are related and then linked propositions to each other systematically to come up with a theory. The 5 axioms generated to create the 2 propositions. Every person has holistic needs, which may include spiritual needs. As people grow older, some tend to contemplate more on matters of mortality and spirituality. People have different understanding and levels of spirituality. Internal and external environment contributes to a person's spirituality. Holistic nursing care includes spiritual care. The propositions to form the backbone of the spiritual nursing care theory. The first proposition states that the meaning of spirituality differs from person to person. The second proposition posited is that the patient's spiritual well-being is influenced by the nurse's spiritual competence, as well as the patient's internal and external variables. The framework shows that the triumvirate interconnection among the nurse, the external environment, and the spiritual nursing care helps obtain spiritual well-being. Providing spiritual nursing care thus requires congruence between the nurse's spiritual competency and spiritual nursing care provided to meet the patient's spiritual needs. Nurses should look at the spiritual needs of the patients from a nursing perspective instead of a spiritual one. Spiritual nursing care should be institutionalized either in the curriculum or through training provided by the hospital. Linkages with other disciplines in healthcare should be strengthened so that there will be cooperation in taking responsibility for spiritual care.